When it comes to decisions about healthcare, it's no surprise that many of the most crucial are about the end of life. But a new survey shows considerable dissatisfaction with that care on the part of family members. One factor is the communication gap within families as well as between families and providers. Our guest is part of an effort to close the gap. She's a founding member of a new Massachusetts Coalition for Serious Illness Care, in addition to having been a Pulitzer Prize-winning columnist for the Boston Globe. We'd like to welcome Ellen Goodman. Thank you very much for being with us, Ellen.
Thank you.
Begin with your story. What got you involved in this?
Well, one of the things we've discovered is that everybody has a story, and it's a story about a good death or a hard death. I mean, everybody has. Everybody who's listening has some story that they remembered. And my story really was at the end of my mother's life. My mother had dementia at the end of her life. She couldn't decide for herself what she wanted for lunch, let alone what she wanted for health care. And I was her decision maker, and I was pretty startled to discover that I had this cascading number of decisions that I had to make toward the end of her life. And I wished that I had heard her voice in my ear telling me what she wanted. And my mom and I had talked about everything except how she wanted to live at the end of her life. The closest we had ever come was when she would say, if I'm ever like that, you know, pull the plug. Well, there was no plug to pull. There almost never is. And so this whole trajectory of serious illness toward the end of life, we need a lot more. We need to be much more sensitive and find out what it is that people want, to have people express their wishes and to have those wishes in turn respected by the healthcare system.
Well, I started off by referring to end-of-life care, but you have a different term for the coalition. And why did you choose serious illness care? Because
we're not just focused on dying. We're focused on how you live comfortably and well through a serious illness, all the way through to your last day. So we wanted to think about it as a coalition on serious illness, so that it would include people who are in palliative care as well as people who are in the hospital. And also we want to be sure that families have conversations about their wishes early at the kitchen table before there is a crisis. And that's really incredibly important.
And I can give you one example. I'm familiar with, you might have a relative who has a heart problem, wears a pacemaker, and there comes a point where the physician says, you should ask mom or dad, when is it time to take out the defibrillator? Because if you don't take it out, something happens. They're going to get some very, very aggressive care.
Well, there are a huge number of questions about this, but the big thing is that people need to express their wishes early, need to have these conversations early. I mean early, when you get your driver's license, when you have children of your own. We did a survey, and at the Conversation Project, which is a founding member of the coalition, and said that 90% of people think it's important to have these conversations. Now, 90% of Americans don't agree on anything, even the national anthem. So this is incredible. But only 30% had. And when we asked them why they hadn't had these conversations, they often said it's too soon. And that philosophy was replicated in a survey we did in Massachusetts. People said, it's too soon, I'm not sick, But we know it's always too soon until it's too late. So you need to have these conversations early.
What happens when it's too late and these conversations don't take place?
Well, what may happen is that the people you love may not die in the way that they would choose. And the survivors may end up feeling guilty and uncertain and depressed. There's higher levels of depression among people who haven't had the conversation, and very uncertain about whether they did the right thing.
And I guess maybe there's also a default response by providers that basically maximum intervention, maybe with maximum dependency on on long-term life supports too?
There may be. You know, Americans face the healthcare system with two conflicting fears. The fear on the one hand that you won't get enough healthcare, the healthcare that you need and want, and the fear on the other hand that you'll get treatment that you don't want. So what we're saying is you have to express your wishes, and the patient's wishes should be right at the center. If you want everything, the whole enchilada, you should express that wish. And if you can imagine a time in which you would want only comfort care, you should express that too, and you should pick somebody who can make decisions for you if you can't make them for yourself. That's critical. We know, for example, that half of all the people over 65 who enter a hospital can't make decisions for themselves. That's a pretty big number. So you need to pick somebody you trust to make those decisions for you.
Well, we've heard advice like that before, so what does the coalition want to do now to make sure that more of us take it to heart?
Well, we have a whole goal and a whole strategy, but basically what we've done is we've brought together an awful lot of groups in Massachusetts who are all working and caring about this, whether they're palliative care doctors, whether they work in a hospital, or whether they work in assisted living, or whether they are working, as we are, in the public engagement space to as the Conversation Project is. And we brought them all together to agree on and commit to a series of goals that will spread the conversation among healthcare providers and among the public. So we need to work in lots of different places together, and our goal is to have basically everybody in Massachusetts have the conversation, choose a healthcare decision maker, and also to have all the people in the medical world have access to these decisions and to have training and having conversations themselves. The survey that we did in Massachusetts said that 85% of our citizens think they should have these conversations with their doctors and providers, but only 15% actually have. So we have a long way to go to bridge that gap.
Ellen, speaking of gaps here, there's not just a conversation gap, but I guess there's also a racial gap when it comes to people who are having the conversations.
Yes, we have found that in our survey of people in Massachusetts, those least likely to have had the conversation are men, and they are minorities, and they are people who have had a high school education or less. So these people's voices aren't heard anywhere nearly as much when they have a serious illness towards the end of their life. And it's really critical to have their voices and their wishes central to their health care.
Right. Well, thank you very much for being with us, Ellen Goodman. And if you want more information, you can go to the website maseriouscare.com.